Morning, everyone. We call this meeting to order. This is Tuesday, April 5th, 2022, and this is the Committee on Aging meeting. Bobby, would you call the roll, please?
Cheryl Hentz is excused. Heidi Bassford Kirkhoff.
Here.
Julie Kiefer.
Here.
Julie Davids excused. Bryn Seaman.
Here.
Lindsay Temple is excused. Julie Maslowski is excused. Judy Ritchie.
Here.
Mike Ford is excused. Michael Norton. Joanne Murphy-Spice.
Here.
Jean Wallerman.
Here.
And we do have a quorum, so aren't we lucky? Everyone received a copy of the March minutes. Are there any additions or corrections? Hearing none, do we have a motion to approve?
I'll move.
Do we have a second?
I can second.
Discussion? All those in favor?
Aye.
Opposed? Bobby, did we have any citizen statements?
None.
Public comments?
None.
Okay, then we're ready to go ahead with our speaker for today, Kim, and let's hope I'm pronouncing it right, Marhini?
Good job.
Okay, and she's with the State Ombudsman Program. So, go ahead.
Thank you. Good morning, everybody. Thank you so much for the invitation. It is just a pleasure to be with you. I'm an Oshkosh resident, and I have caught your meeting online a number of times, and so really appreciate your work on behalf of the maturing adults of Winnebago County. So thank you so very much. As Judy said, I am with the Board on Aging and Long-Term Care. I supervise the Long-Term Care Ombudsman Program, so I'll be talking about that with you today. The Board on Aging and Long-Term Care is a small state agency. We are not part of the Department of Health Services. We're not regulators. We are advocates. We're an independent agency that receive most of our services through the Department of Administration under the Office of the Governor. So that enhances our independence on behalf of the consumers that we serve. I'm going to talk with you today mostly about the Ombudsman Program, but I want to give you just a little bit of a snippet about our other two programs as well, our Medigap Helpline and our Volunteer Ombudsman Program. Our Medigap Helpline, I oftentimes refer to as one of our best kept secrets. Our Medigap staff are licensed insurance counselors. Though we don't sell any product, we assist persons with trying to narrow down their choices. The few of us in the room who are close to or of Medicare age know how confusing that can be when it's time to enroll in Medicare, Medicare Part D, or even to understand benefits such as senior care drug assistance programs, any veterans or military benefits, or COBRA and continuation if you're a retiree maybe of a company that perhaps is closed many, many years ago when General Motors closed their plant in Janesville. Our Medigap counselors assisted more than 4,000 retirees in trying to realign their retirement benefits. And so it really is a fabulous program for consumers, free of charge, as all of our services are. And really they're only to help consumers identify what their options are, not certainly to promote any product over another. Our Volunteer Ombudsman Program is a super volunteer opportunity and an opportunity unlike any other. Our volunteer ombudsmen are each assigned to a particular nursing home that they agree to visit on a regular basis. Before they come to us, they are fully background checked. They go through a very thorough orientation to long-term care services and advocacy approaches, as well as how to work with our Ombudsman Program. And so they visit those nursing homes typically once a week for a couple of hours. They try to talk with every resident they can find, family members who might be visiting, to ask about their experiences, to find out, are their expectations met? Or do they have need perhaps to speak with an ombudsman if they have issues that they've perhaps not been able to resolve with that nursing home? in that mandated grievance process that is required. We've got volunteers who've been with our program for 15 years, always with the same nursing home, and so very dedicated, as well as volunteers who are brand new and so appreciative of that opportunity to be able to provide some good advocacy on behalf of people who live in long-term care settings. And then I'm going to spend the rest of the time talking with you about our Ombudsman program. And typically the first comment I hear is that word ombudsman is impossible to say. And I will agree with you. Several years ago, the Wisconsin Aging Network did a survey of older adults about advocacy services. And one of the comments that came out of that was, who came up with that name ombudsman? Because you need to change it, you need to fix it. And I'll tell you, that's the name Congress gave us back in the 70s when ombudsman programs were first designed, and so it has stuck. And actually, we do hear that word in other areas. We hear about insurance companies that now have ombudsman. We hear about hospitals who have ombudsman representatives. So it's a word that's starting to catch. Although more frequently, we're hearing ombuds, leaving the man off. But it's what we have, and it's what we work with. We're authorized both by state and federal law. Our state statute guides our work on a very focused level and defines those entities that we serve. And our federal statute really guides our overarching work and discusses those very basic tenets of our program. For example, confidentiality, consent, those rights of residents to be treated with all dignity and respect, to not only receive quality of care, but to receive the highest quality of life. Ombudsmen work with anyone. Our only client is that resident of a long-term care setting or that person who receives their home and community-based services through the Family Care or IRIS program. But our other stakeholders also come to us on behalf of those persons with a variety of concerns that we're happy to address. And I'll flesh more of that out in just a bit. I mentioned to you that ombudsman programs have been around since the 70s. And actually, the program here in Wisconsin really is a program of great distinction. Back in those earliest days, Congress identified that complaints about nursing homes at that time, assisted living was only a dream then, but nursing home complaints were really egregious and coming in at such a volume that nobody really knew what to do with them. And so the Congress asked for 5 states to volunteer to set up a program of advocacy to try to resolve complaints before they really got to be so egregious on behalf of persons who lived in those long-term care settings at that time. Wisconsin was one of those 5 states. And today, Wisconsin remains a leader. We have an operational standpoint that looks nothing like any other ombudsman program in the nation. We're very proud of our program. Very proud of our volunteer entity as well as that Medigap aspect. So we really feel like broadly we meet a wide range of consumers who live not only in the community but also in long-term care settings. A bit after we received that authorization to serve people in nursing homes, then ombudsman programs were expanded across the nation and into the U.S. territories. And then we're also charged with serving persons in assisted living. So today, ombudsman programs serve persons, as I said before, in all licensed and certified long-term care settings, as well then in those places where people receive their home and community-based services. In Wisconsin, we serve persons in our program who are over age 60. People who are younger than age 60 would get their advocacy services by Disability Rights Wisconsin. Although we do a lot of co-work together. It's not unusual, especially today, to see younger individuals, persons under 60 who are in a nursing home, either for recuperative care. Many times we see people there who, because of the degree perhaps of mental illness, have not been able to find care anywhere else in the community. And so we'll sometimes partner with Disability Rights Wisconsin to try to find a community option for that person so that they're still engaged in their community. They still have that highest quality of life, but then they're also living with a peer group perhaps that is more appropriate. Our authority gives us access to our consumers at any time. No nursing home, no assisted living community can disallow us from coming in to see a resident. At the same time, no facility can keep a resident from seeing us as well. And those visits need to be confidential. We do not share any kind of information that a consumer might share with us without consent. And then we do so very carefully. And I'll talk about that just a little bit more. I always like to make sure that people know that our ombudsmen are certified, and this comes out of our federal rule that ombudsmen must conduct themselves according to a particular set of standards. And so here in Wisconsin, and again, we really exceed those requirements in a significant way. Our ombudsmen typically are trained in at least 500 hours of classroom and field-based topics that include special populations, legal issues. Working with boundaries of decision makers is a very big topic for us these days. How to assist persons through that due process system. If someone has been abused, how do they find their way not only from that point of immediate contact maybe with law enforcement or adult protective services to victim services so that they can come through that trauma perhaps in the best way possible. We work with community networks and entities to build those collaborative relationships that are so very essential. We could not do the work that we do without aging and disability resource centers, without adult protective services. We participate in community interdisciplinary teams so that we're all at that same table, but each of us having that same goal of best quality of care, of protection, of respect for rights. We all have that same goal, but we might come to that goal maybe a little bit differently. I've spoken already about who we serve. Anybody can call us again. One of our most frequent challenges is we've come through COVID, and that was a very interesting time for us. Our federal oversight pulled us out of any long-term care facility for a long period of time during COVID. We've only been back into the field for about a year. So most of our contacts at that time, we learned a lot, as all of us did, about doing things virtually, about being able to resolve things in ways that previously we've relied on that face-to-face contact. And I can tell you, persons in long-term care, their family members, and those may be some of you, really did suffer during that time. So we are advocates now for making sure that if ever we would go through a pandemic again, or even now as we watch some of the variants of COVID begin to arise, that we're very careful not to plunge people back into that period of isolation that really was life-changing for so many people, and you may know who some of those people are. But what's been interesting about many of our complaints is that a family member, a friend, a pastor, somebody from the community may call us with concerns about the quality of care that somebody is receiving in a facility, or the quality of food, or the lack maybe of social programs as facilities try to build back their staffing. And sometimes we go in and we speak with that resident. That's the person we always start with. Anyone can call us, but we verify our information with that resident or that client. And many times that resident says, nope, I'm fine. Everything's good here. And so we don't just walk out the door. We use our powers of deduction and observation. We do a good walk around. We talk to other people who live in the building. We talk to staff and try to figure out how things really are going in the day-to-day in this particular setting. And sometimes that resident, they have all they need. Their needs are met. They find that people are gracious and courteous to them. And our most difficult role sometimes then is to go back to that family member or that complainant and say that we were not able to verify that complaint. And many times it really is kind of that culture clash that family members think things should be done differently than that resident may. And I'll tell you a personal story about that. Pardon me. my grandma, when she was 94, moved to a nursing home after she had taken a bad fall and just could not live alone anymore. And it was the same nursing home where when I was a 15, 16-year-old kid, I worked as a nursing assistant. And so that was kind of home to me too, although obviously in those many years that had changed some. And so when I would visit her, I would see things that I thought, boy, you know, maybe they could do this a little bit differently, or wouldn't it be better, Graham, if things could be like this? And Graham would say, nope, I like it this way. Don't make a fuss. Everything's fine. And on only one occasion, I asked her how she was doing, and she said, well, you know, I like it here. The people are nice to me. I have all that I need, but I feel like I've lost a little bit of my freedom. And so I think about that with every client that I interface with today, to make sure that they know that their freedom is limited only by the limitations they might put upon that themselves, that there are people like the ombudsman, like the volunteer ombudsman in our program, that will help them express those freedoms to every extent that they might wish. Rights are guaranteed by state and federal laws. That really seems like it should be a no-brainer, but I'll tell you, rights are disregarded every single day, and certainly I don't think by intention. Sometimes those rights about where I live, if I'm a family care member, for example, sometimes the family care program needs to make changes in where a person lives so that it's not only the most effective setting for that person, but the most cost effective. And so I think some people would tell you that today their choices might be less than they may have been 20 years ago. Living in Oshkosh, I moved to Oshkosh as a college student, and so I've gotten to know the healthcare environment in this city very well, and I always knew where my mother-in-law thought she might want to be if she needed to go to a nursing home or an assisted living community, and those abilities to make that choice today are different, especially if you're reliant on public funding to be able to manage that care. And so it's really our job, it's the job of an ombudsman to make sure that those residents or those clients' wishes, their rights are heard and respected by everyone. And what I always like to remind people of is that the only person that can remove rights is a judge in a court of law. It's not a power of attorney, it's not a guardian, it's not a sister or a husband who can diminish rights. It is only a judge in a court of law. These are just kind of a basic list of what our most common rights complaints are these days. We submit data every year to the federal government, and we just finished that data run for the last federal fiscal year. And so these were the very top of the list. They don't change much from year to year, but they balance out a little bit differently. Currently, right now, discharge planning and inappropriate discharges is probably our very top complaint. Many of these go to that second bullet, insufficient staff. Long-term care settings, if you watch the news, you certainly see that. Hospitals, long-term care settings, physician clinics are struggling to have enough staff to provide the care that clients and customers need today. And so just about all of these have some role in staffing. Financial exploitation is at an all-time high. Our staff, I talked earlier about that importance of relationships and communities. Our staff are in routine contact, it seems these days, with Adult Protective Services to talk about these family members who are using mom's money not to pay mom's nursing home bill, but perhaps for their own gain or to cover their own bills. As a nation, ombudsman programs are taking a look at, we hear about, what do they call it, the great retirement or something like that communities experienced through COVID when so many people left their jobs. And we're wondering if some of those people are today living from mom and dad's money, if they're helping themselves a bit to a pre-inheritance. Unfortunately, that also puts mom and dad at risk to be involuntarily discharged from their facility, who deserves to be paid for the care that they receive. Ron would know this, certainly having having worked in long-term care for so very long. But you know that if you go to apply for medical assistance and you can't account for how you've spent your money in the last 5 years, medical assistance will be denied. And those cases are also on an increase today, where persons are being told that they cannot be approved for medical assistance because they've inappropriately divested themselves of some of their assets. Our concerns about abuse and neglect are higher than they've ever been. Again, we hear from family members who maybe just were able to get back into their mom's assisted living community or nursing home after having been out for so many months or maybe even a couple of years, that they see that mom has lost weight or that she seems more disoriented than she had seemed previously, maybe that she's taking more medications for mood or anxiety than she had taken before. We hear more issues about changes in skin integrity, in nutrition and hydration, more people going to the hospital, more people falling. And again, I point back to that second bullet, that insufficient staff may be part of that concern. One of the concerns we have as an advocacy agency is when the pandemic first hit in force and people began to realize that this was not going to be a short-term thing, the federal government, the Centers for Medicare and Medicaid, put out some waiver opportunities for long-term care settings in order to be able to really maximize their staff, certainly not to diminish care in any way. But one of the waivers was a decrease in training hours for certified nursing assistants. And my agency had just spent the prior 2 years arguing that at the state legislature to be able to keep our 120 hours that we had 15 years ago worked so hard to achieve through that legislative process. And then I will tell you there was great debate about that. There were many people in favor of dropping those numbers down to the federal minimum standard, which is 72. And then with that CMS waiver, then during the pandemic, those hours were dropped. And I fear that we will never get those back. And I think that shows today in some respects. The hours that were added to that time, those 15 years ago, were things like how to serve people with dementia. Those very person-centered approaches to how you work with persons who have memory loss or particular mental health conditions. They really were all about rights and interpersonal relationships, and that seems to be so telling in our work today that they really are missing. We work a lot with substitute decision makers who, as I mentioned before, think that power of attorney for healthcare paper, that guardianship paper, gives them kind of free rein to exercise their will over mom or dad, and sometimes in ways that really do diminish the rights of mom or dad. We get complaints about that disregard for the plan of care, and facility closures, I will tell you today, are at an all-time high. I've been in my position for 15 years, and we used to see maybe 2 or 3 closures a year. And I will tell you right now, we have probably 6 going on, and a couple that we know are coming up. And again, it's become quite unsustainable, I think, for some aspects of long-term care. In Wisconsin, we've got very old nursing home buildings. Some of our nursing home buildings are 40 years and older, and so they're expensive to maintain, and very few nursing homes today are running at a full census, and so they're also very difficult to staff. Assisted living has provided a super option for consumers to be able to have choices in their communities. Winnebago County, I don't know if it's still the case, but Winnebago County used to have the distinction for having the most number of assisted living beds per capita in the state. That can be a good thing if you're a consumer. It can offer you a lot of choice. It can be a real challenge if you're a provider, then especially in this very tight labor market, to be able to find enough staff to provide the care that you give. And what people oftentimes don't know as consumers is that assisted living is not a nursing home. Assisted living is not required to have nursing staff or credentialed staff. And so we see acuity levels sometimes in assisted living as not necessarily being appropriate to that setting and the services that it can provide. So I don't believe anybody goes to work during the day thinking that they're going to violate the rights of the people that live with them. I think that there are certainly those systemic changes that might promote some of those violations. I really, again, admiring the work that you do at this table, that paternalistic view sometimes, that ageism that society sometimes has for older adults, that assumption that because somebody's 85 or 92, that they're less capable in some way. I think sometimes that perpetuates that thought that we need to be more protective than we need to be. In my work, I work a lot with residents who want to take risks and who would gladly balance quality of life over safety. And so we work a lot with providers and family members and residents about how can you navigate that in the best way possible so that people get what they really want from life. Talked a bit, that is all stigma, right? It's that stigma of aging. Medical model of caregiving versus person-centered. We had done such a good job in those years in the 80s and 90s of really trying to get away from that medical model of care, particularly when we looked at institutional care. And I fear that we've done some backsliding in that regard in a number of ways. And then I just mentioned to you that inadequate training of providers. And then there are those individual issues that might cause rights violations. A person's educational level, their life experience, their family dynamics, if they grew up in a home that wasn't supportive or didn't view that person-centeredness in a way that enhanced a quality of life, that may not be a person's instinct. They might not have that knack in doing the work that they do. And then there is that situational that we have just worked our way through, things like pandemics or other emergency response issues, fires or floods, those other things that kind of get people working by instinct more so than by thought process. And staffing, that situational, I hope it will be situational and that we'll find our way through this staffing crisis at some point soon. I've been talking a bit already about self-determination and risk, that right that I bet some of us took risks already today. Maybe we blew through a yellow light because we were running late. Maybe we didn't eat breakfast and somebody told us, you really need to start your day with some good fuel for your body. That's a risk, right? It's a risk. Maybe we decided to not take our medication today or skipped a part of our daily regime that, at first glance it doesn't seem very risky, but if you do it day after day after day, there's risk involved in that. We see every single day in long-term care settings, people just really want to live their lives. They want to live that life with a quality that was common to the way they led their life as younger persons. And it's really an advocate's job to help them be able to express that in a way that is taken seriously by the people that care for them and who care with them, and in ways that are meaningful. And I love that phrase, that there are people who every day would prefer to choose quality of life over safety or quality of life over length of life. And this is when it can get to be challenging sometimes in working with surrogate decision makers, where people say, but I don't want my mom to go out with my sister. She doesn't make sure she eats good food, or she keeps her out too long and then she's exhausted when she comes back to the nursing home and maybe can't participate in supper. And so it's an ombudsman's job to help people find that middle of the road that respects what the resident wants to do, with hopefully a bit of safety that keeps them from being exposed to something that could be certainly life-threatening. Questions for me?
I have one, and I'm not sure if you're going to be able to handle this because this might be a bit of a stretch, but you were talking about staffing issues. And I know of businesses that has closed as well because of that. And what I'm hearing from the homes or the facilities or the organizations is that the reimbursement that they're getting from the state of Wisconsin isn't enough to pay people a decent wage. Are you familiar with, or are you aware of any legislation going on at the state or national level as trying to address that?
Yeah, I love that question. Thanks for asking it. I don't have the $1 million answer.
Okay.
I can tell you immediately that long-term care facilities in this budget received a nice increase, both on the nursing home side and on the assisted living side. And I know that the governor's budget also built in some pay for quality service to the family care and Iris budgets as well, so that there are some improvements there. I will tell you, it has seemed like especially those Medicare and Medicaid dollars had stagnated for quite some time. But I want to say, this is a systemic issue. We have been talking for decades about the need, in particular, to recognize the importance of long-term care services for the people who built our communities. And you have to do that by, number one, allocating enough dollars to make sure that people can provide that care, can afford equipment that is that is safest, not only for the people the staff that have to operate the equipment, but the people that need to benefit from the use of that equipment. But more than anything, I feel like we need to benefit the people who work in long-term care settings. We need to elevate the importance of the role of a certified nursing assistant or a resident assistant on the assisted living side. Years ago, and this is where I first met Ron, I worked in nursing homes for more than 20 years. That is where my life started. And I remember working with a nurse who I admired greatly. And she said she didn't know how long she'd continue to work in that nursing home because she felt like she would lose her skills.
Yeah.
And that's just wrong. That is just absolutely wrong. Nurses in nursing homes today have to make some of the most challenging decisions and make them quickly and know how impactful they are, not just to the residents that are impacted by those decisions, but the rest of the staff who work with them as well. I listened to a webinar several months ago about the staffing crisis in the United States, and one of a very small study, and I can't tell you today where it was done, but they said one of the reasons the persons running the study interviewed nursing assistants who had left long-term care jobs, and they wanted to know why. And it wasn't money, it was about recognition, and it was about their role models. They had seen their nurses or their charge nurses, their directors of nurses, their administrators, their social workers responding to client needs in ways that were not respectful and did not portray that degree of respect for that resident, for their role, for their profession, in a way that made them want to stay and choose that as a career. And I think that's just sad. So somehow, as a country, as a legislature, we need to figure out how to recognize the fact that this is one of the hardest jobs I think people can do. When you need to be able to respond to a person's needs immediately in a way that gets to their heart, that lets them know they're safe, that comforts them, that celebrates with them, whatever that may be. That's the hardest, probably the second hardest job maybe to being a parent. And we just haven't done a good job of figuring that out. And we're paying for that now. I think we're paying for that now. Thanks for the question. Anybody else?
I'll say something really very much supporting the Ombudsman Program. And in my own family, we had an issue a number of years ago with an assisted living facility. And Carol Kremelmeyer was Kim's position back then. And so I made contact, and I had been very careful, again, because of working in aging already, I was very careful about documentation. And so when my complaint was investigated, I provided every email that was sent or received from the facility. And amazingly, what the facility provided was missing a number of them. So if I had not had that, our claim would have been viewed far differently. So it's, as much as families don't like to keep a diary, some type of documentation, unless they do that, they really don't have a good picture of what is going on, both directions. And I just wrote 2 letters to Human Resources with a facility for the outstanding work of staff, of the amount of respect that was given, the care that was given, and going above and beyond the job description. So there's 2 ways of looking at it. And one is where like you said, it's the perception, and the other can be the reality. So again, I think the program is one of the best treasures we've got in working with aging.
Thanks for that, Judy. I want to say one of the things that brings an ombudsman to this work is that we're not regulators. We don't look at the black and white. We have to know the regulations. Ombudsmen have to know the administrative codes of every single entity that we work with. But I think one of the things we do best is trying to work with a provider, and maybe particularly with a provider that doesn't want to work with the ombudsman. They see us as the state or somebody who might call in the regulator. We really do our very best work if people call us early when they see that a situation is developing that could be challenging, so that we can be preemptive and really try to help that provider mostly see things from that resident's perspective, that client's point of view, and then try to massage the situation to see if we can get there, if we can meet that person's need, so that you don't have to call in a regulator. I know that. And I have great respect for the regulating agency, but I know that when they're there, they're really looking at the black and white. Are you doing things according to the regulation? And sometimes the person gets missed in that process, which is kind of surprising because the regulations exist really to protect the care of the people who live in those settings. So, speaking of Carol, Carol was excellent at that art of negotiation. And that is one of the things we do best. I love when I hear from a provider that they didn't want to call me, but they were so glad that they did, ultimately. I did a presentation a couple weeks ago at a large state conference, and there was a woman who talked with me afterward who was just in tears because she was new to her role as a director of a very large facility. The only orientation that she had gotten to that role was how to make sure bills got paid, how to make sure that she knew how to do an involuntary discharge if bills didn't get paid, kind of the hard stuff, how to have a big, strong backbone. And we talked for a while. She was just really sad because she said, I feel like I've been missing out on the people. I haven't been kind. I haven't tried to consider the point of view about why maybe that bill didn't get paid. I haven't gone to every length possible in a person-centered way to try to bring about resolution to some of those problems, but now I can do better. And that made my day, to be able to see that she'll call again if she gets into trouble. And I so appreciate that. But I think that's the strength of our program, is just that ability to be front and center on behalf of that client, but respectful of everybody who's around that table. Anything else I can do for you?
Ron is no longer on the committee, but we'll let him voice a question or comment.
Over the last couple of years, the Committee on Aging has spent some time reviewing the governor's task, caregiver
Yes,
task force.
yes.
I'm just wondering, the recommendations that came out of that task force, have you seen some positive, maybe some of the increases in pay or whatever that have gone to assisted living and
Yes.
nursing home staff that may have come out of some of that impetus?
Yes, I think the other thing that has come out of the governor's task force on caregiving is really, and I think this is really key, a greater focus on what communities can do. Communities, you don't just move your mom to a nursing home or an assisted living community and expect that you've done your job. You really need a community to branch around and support, and not just for that person living in that long-term care setting, but just living in your community, so that people don't necessarily need to go to a nursing home or to an assisted living sooner than they may want to. I don't know the current statistic, but it used to be that only about 15% of persons in a community actually lived in a long-term care setting. Everybody else was living in the community, either with formal supports for care or, more frequently today, with those informal supports that I think the governor's task force is really trying to impact. But then to also recognize that some of those caregivers, too, do need to be compensated. We see people, particularly in the family care and IRIS programs, who quit their jobs to take care of their mom or their dad or their sibling or their spouse, and can't live on $10 an hour and shouldn't have to, especially while they're doing a job that is so very important and that has the potential to change that relationship as well, which I also hope that task force will start to work on. How can we be caregivers and still be husbands and wives and sisters and brothers and sons and daughters without diminishing that relationship too? It's good work. It's very good work.
Thank you.
Thank you. I really appreciate your time, and thank you for your work.
Thank you. Moving on, old business. Does anyone have any? New business. We talk a bit about current scams. Heidi, did you have something?
I did. As a corporate guardian, I go through a lot of clients' mail, and I have a new client that I had been going through the mail, and the amount of mail she received was astronomical on organizations asking for money. And going through her checkbook, I found out that she was sending a lot of people money. And so there's one I wanted to talk about that I had done some research last night on, and it's the government imposter scams. And that these government imposters will call unsuspecting victims and pretend to be from the IRS or from Social Security Administration or Medicare, and they say that you have unpaid taxes, and they threaten to arrest or deport you if you do not pay immediately. The ones that I was seeing in my client's mail was from Social Security and those who fight for the seniors, and they would say that, unless you donate to our organization to keep Social Security going, your benefits are in danger of being cut. So they want their personal information, they want their money for fighting the good fight, if you will. Government imposters often spoof the actual phone numbers of the government agency, so it looks like it's coming from the government agency, or they will call from a zip code for Washington, D.C. And so it looks legitimate. And so that is the one I wanted to highlight today.
Okay, thank you. Does anyone else have any comments on that or any other scams they'd like to address? One of the tools that Ron and I have used over the past few years is called the Wisconsin Senior Medicare Patrol, and there's a newsletter that comes out quarterly, and it has lots of information on scams and resources and things, and we'll make sure that the links and other information go in our minutes and be available as an attachment as we move along. Okay, other business. Upcoming community events for older adults. Bryn?
Oh, I don't know if I have upcoming event. Well, I know I do, woven into our EDRC newsletter. So this is for the Winnebago County, and as always, we have not only the Committee on Aging on the April events, but there's the Memory Cafe, Powerful Tools for Caregiver, other respite options, and ongoing classes. Recently added to, I see there's some MindWorks with the Fox Valley Memory Care, I believe. So I'll pass this out as I normally do. One thing I wanted to highlight, because it's something both professionally, but then also now seeing the impact it has personally, I wanted to promote, it's free online programs from a company called Trewalta. So in years past, SQUAR, the Greater Wisconsin Agency on Aging, had contracted with Trewalta, and now DHS has, to make sure that these free resources are available to family caregivers. It's helpful beyond just family caregivers, truly parents who might be working with children with difficult behaviors. If you want to learn some information about power of attorney or legal issues, there's a lot of good information in here. So I've been trying to help disseminate this amongst all the counties in the state, and I was happy to see that in the Winnebago County ADRC newsletter. It would have been Elise that had put it in. So I'll just share that and pass it around. Again, it's free of charge. So sometimes folks come to the ADRC and maybe they aren't available for different enrollment to other programs, but that one is something that is available on your phone, on your laptop, your desktop. And a nice feature too is in some of the cases, the educational programs can feel a little like a podcast where you can just click the audio and then you can listen. And lastly, I'll just say that there's a lot of featured information from Tifa Snow. And those of you who are familiar, there's a lot of information related to dementia and Alzheimer's as a caregiver, how to handle some of those challenging situations.
Okay, thank you. And Julie?
I could announce that our registration is open for Grandparents University at the university, so if anyone is interested, they can contact Continuing Ed at UW Oshkosh.
Many people don't know what Grandparent University is.
Sure. Grandparents University is 2 days on the UWO campus where a grandparent comes with their grandchild who's between the ages of 8 and 12. You pick a major and you do some learning and fun activities together, and you do have the opportunity to spend the night in the residence halls as well if you would like. We take commuters as well, but
It's a great opportunity. Really, the bonding and tools for learning from both sides. So, Joanne?
That's a cool program. I have a 5-year-old granddaughter. I'm like, okay, 3 more years, we can go.
yeah.
We have 7 classes started this month. So things are taking off after COVID, which is very, very exciting. And our focus with the ADRC is going to be on falls prevention for our classes. So we have a stepping on class that is currently happening in Menasha, and strong bodies, which is strengthening, and Tai Chi. We have 2 of those that started yesterday. We had 2 strong bodies start yesterday. So super, super excited. I know Jean and I are talking later about getting them started up again in Oshkosh. So really, really excited. And there's also a program that came through on grants. Jean's one of the leaders, and it's called Stand Up and Move More. My voice. I must have left it in Florida. Anyway, it is not an exercise class. It is a class for people who sit more than 6 hours a day, because that's the equivalent of smoking like 15 cigarettes a day. And getting people, exercise is kind of a big step for a lot of people like that. So it's like an intermediary program to help people just get up more. And I know that tomorrow there is one starting at the Bethel Chapel, and then in May Jean is starting one at the Oshkosh Senior Center. And I think it's a great opportunity if you know someone who is just spending too much time in a chair on the couch. It's non-threatening, it's not exercise, but making that step of just more conscious decision to get up, and the big difference that can make in your independence. So I'm kind of promoting those right now.
Hey, thank you. Heidi?
Not only am I on the board, of this board, but I'm also the president of the Oshkosh NAMI organization. And we have been receiving phone calls, referrals. Our requests for information have quadrupled over the pandemic. And we know that there is an increase of mental health concerns, especially in the elderly. or the older population. Fortunately, we've also seen an increase of mental health awareness. And we're hoping with this that it'll reduce the stigma that is associated with mental health illness. Our website is namioshkosh.org. If you wanted to contact us, you can email us at info@namioshkosh.org, or our phone number is 920-651-1146. We do have an event coming up, which is the NAMI Oshkosh 5K and mental health and suicide awareness. I don't know anyone who hasn't been touched by mental health, or even, a death by suicide. And so we have an event coming up May 7th at Oshkosh North High School at 9 a.m. for our 5K walk. And it raises money to help support and educate and advocate those who are affected by mental illness, because all of our services are free. So again, if you want to talk to Mary Janice, who is our director, her phone number is 920-651-1148. If you need any assistance, check out namioshkosh.org and look up our 5K walk, which is coming up on May 7th. Thank you. Jean?
Yes, our April newsletter is available in the community and also at the Oshkosh Senior Center. There's one event I just want to share. Our friends of the Oshkosh Senior Center is doing a shred event on May 21st, and that's held in our north facility. So anyone can come with paper, file folders, hanging folders, computer paper, notepads, envelopes, and they can be shredded at this event. So again, May 21st coming up. And then Julie, there's a couple LIR events happening.
Jean suggested I mention a couple of these. So I'm also a program manager for the Learning and Retirement Program at UW Oshkosh. We've been partnering with the Senior Center to offer some of our programming there as well. And two of the ones that are coming up in April that we have probably some room for is the Livable Communities and Aging Plan, which will be done by someone from Public Health and or the county, I should say. And then also Dr. Brian Davis, our superintendent of the Oshkosh Area School District, will be speaking on April 19th. So to kind of hear about he'll be almost a year in by that time. He started July 1. So looks like those are right next to each other. Monday, April 18th for the Livable Communities and Aging Plan, and then Tuesday the 19th for Dr. Davis.
And I've heard Dr. Davis speak, and it's a fantastic presentation, so I really encourage all to attend. It's really, he's got some great ideas for our school district, so it's very exciting.
Thank you. I'm always looking for a little extra information on what's good in the city. And one of the things that was just announced last month is the acquisition of a therapy dog to the Oshkosh Police Department. And yes, Magic is the puppy's name. It's actually a 2-year-old female, golden retriever, and professionally trained to provide emotional support to both members of the community and officers. She'll be working with the behavioral health officer, which is a new type position with the police department, being proactive. Scott has been there since October, and responding to behavioral health-related calls, highly sensitive emotional calls for service, as well as being used as support to support employees of the department after critical incidents. And along with that, as I go a little further, the police department has been partnering with the Human Services to provide a mental health crisis specialist co-responder. So we're seeing a lot more collaboration than, and we'll refer back to Bron out there, when we started in aging quite a few years ago, to the fact that we're being proactive, and it's not always cut and dried how situations are handled. And so really encouraged by hearing things like that.
Judy, I'll say that Jane and I have booked that speaker as well. So that's, I think, in November, though, before that's going to happen. But yes, we're going to have Officer Zapata and the Magic come.
And the hope is we will too here.
Yes, that's great.
It doesn't hurt to be repetitive on those in different venues.
Need to hear stuff like 7 times.
But by then, it starts to sink in and we can
Right,
remember it.
right.
And the other thing is, April 17th to the 23rd is National Volunteer Week. So it's a great way of recognizing the volunteers in the community, which brings up the fact that Mike Norton, who is one of our alternates, is not going to be reappointed. He's asked not to be. So that leaves us with an opening for another alternate on this committee. So if you know anyone, I had a couple of conversations last week with individuals. If you know anyone, have them go ahead and apply. There's the application online or one that can be printed off. And there's certainly other committees and commissions in the city that can also use more members. So encourage folks for it. I think you'll all agree we learn a lot by serving, things that we didn't know before, or information that we have to share with others. So that's my little plug. Does anyone have anything else?
Can I add something? This is a personal thing, but when I was in Florida, I met several people from the United States and Canada who had been to Oshkosh over the years, specifically for the EAA, but without exception, highly praising this community. And I was so proud, like it was really neat to hear them talk about how welcoming we are, the services we provide, the friendliness, and to hear it from a lot of people from a lot of different areas just made me feel really good. So, yay, we're being talked about in a good way. So I just thought that was just really neat.
It is. This is actually more youth, but it speaks overall to the community. And remember, it wasn't all that many years ago we heard about UW0.
Mm-hmm.
And I just saw an article, and I can't remember where it was. University of Wisconsin-Oshkosh is one of the top X number of schools in the country. So we've gone from 0 to
Hero.
way up there, yes. So it speaks volumes for what starts out as a small group and the ripple effect to what we can do for a community. And so it makes you feel good for living here. So, okay. Our next meeting date will be May 3rd, and our speaker will be Andrew Schaller from West High School. And he is in charge of the Veterans Honor Wall at West High School. And they've done a wonderful job of really expanding that wall. But in spite of everything that they've done, they're missing lots and lots of names. And so in some of our conversations, this is a good place to start in looking for more of those. People don't think in terms of getting those names there. And I discovered I had 2 family members that aren't on there that should be. So Larry's got the information in moving forward. So anyway, he'll be talking about the wall, how we as committee members, as well as the community, can help to build on that wall and to honor our veterans, whether they be the 18-year-olds of today that are going into service to even our grandparents of the community that have served. So I'm looking forward to it. So on that note, I'll take a motion to adjourn.
So moved.
And a second, please.
I can second.
Okay. All those in favor?
Aye.
Okay, meeting adjourned. Thank you, everyone.